I'm here at SNP conference with MP Tommy Sheppard, who just passed a resolution to further the case for decriminalisation of drugs to save lives. Tommy, could you tell us a bit about the motion?
Yeah, I mean, first of all, I'm really delighted because the motion in the end was passed unanimously, which I think shows that the SNP is prepared to take some bold, imaginative looks at things, and when things aren't working, as they surely aren't in relation to drugs in our society, to make changes. So, last year we had 1,187 people die in Scotland from a drug-related death. Most of them didn't, probably all of them didn't want to die. Most of them didn't have to die. All of these deaths are entirely preventable. And the case that was made in the motion is that one of the main reasons why this is happening is because the criminalisation of drugs means that people don't come forward for help. If health service staff do want to help them, they fear they're breaking the law. And also law enforcement is focused on people at the bottom of the pyramid, the most weak and vulnerable people, rather than organised crime at the top. So if you decriminalise possession, for example, as they do in Portugal, it removes that stigma. It means that facilities can operate without fear of breaking the law, and it means people can get the help that they need. And we need to do a lot of stuff about drugs. I mean, we need to tackle the root causes of drug addiction, which in most cases is to do with poverty, social isolation, mental health. I mean, all of these things need tackled. But what this is about keeping people alive long enough to allow those interventions to be successful. This is what they've done in Portugal, and it works. Their drug deaths are plummeting while ours are rising.
And do you believe that the support that the motion had at the SNP conference reflects a wider support across Scottish society?
Yeah, I think this is an idea whose time has come, actually, and I just put on record my gratitude to the Daily Record, for example, and the campaign that they've run. So, when you get tabloid newspapers calling for change and campaigning for change, something's going to change, really. I mean, there will be some people, I know there'll be some people who will be uneasy about this. They will feel that, well, it doesn't make sense if you're against drugs that you should, decriminalise them. But actually, this is how we get the people to help them turn their lives around and to build their lives and to become drug-free, ultimately. We need to keep them alive. At the minute, people are dying behind closed doors, and we can't get to them. And that situation's got to be changed.
And just finally, how far do you think in Scotland we should be pushing the legal boundaries, for instance, in going ahead with safe consumption rooms and trying to put up structures that would prevent Westminster from enacting the laws that would put the people who are doing that job at risk of a criminal record?
Yeah, well, I mean, what the resolution says is that the Home Office should act. I mean, that's our initial. All of this law, the 1971 Act, is a matter for Westminster. So we think, that Priti Patel should sign a statutory instrument to change this. It would take her 5 minutes if she wanted to do it. But if she's not prepared to do that, then the matter should be devolved to the Scottish Parliament so that the Scottish Government can actually act on this. If neither of those two things happen, to be frank, I think throughout the UK as a whole, somebody is just going to push it, because we're getting to crisis point now. And what actually happened in Canada was that people started operating drug consumption facilities out with the law, and eventually, the police realised it was stupid to try and prevent them because they were helping the problem, and eventually they got support, and eventually the law changed. I don't know if that's going to happen, but I suspect that might happen. Probably not in Glasgow, but Manchester and other places are likely to do that in the very near future if the law doesn't change. But there is a big head of steam now for people to see sense about this and to try and review the legislation. And I hope that sensible minds will prevail, and I hope that people will take decisions based on the evidence. And all of the evidence shows this is what we need to do.